Can you imagine training so hard for months and months, the whole year long, only to find your deep nagging pain in your lower back that won't go away? You feel like it's a pulled muscle, but it's just not getting better. Well, if you've ever had this, or if your kids have ever had this is something that could be more serious. Welcome to the Cheer Athlete Podcast, where we bring coaches, parents, and athletes expert tips and advice to help keep cheerleaders healthy, strong, and at the top of their game. Now let's go. It could be something that keeps you off the mat for weeks, potentially even a full season. And today we're going to talk about on the Cheer Athlete stress fractures and what causes them, what to look out for, and most importantly, how can you avoid them? So stress fractures are pretty common in cheerleaders and gymnasts especially, and they occur with repetitive strains. So we're going to dive into, what are some common things to look for and what should you do when you have nagging back pain or uh, bilateral leg pain or ankle and foot pain. Is this something you should just ignore or should you get it checked out? So if you don't know me, I'm LT, the cheer PT, and I help cheerleaders and parents and coaches understand and navigate injuries and how to prevent them in cheerleading. And understanding how stress fractures can affect cheerleading performance is crucial as far as keeping your athletes safe and healthy and on the mat. So I get some notes, so bear with me as I look through them today because this is stuff that I have to look up on a regular basis. So I worked with a young woman this week who actually had bilateral femur stress fractures. And she had had pain with running. So she's not a cheerleader, but she had pain with running that was getting progressively worse. But she was like, I just got to get through the season and see if I can make it through. And it's going to be fine. I'll rest afterwards. Well, lo and behold, she stopped running and the pain continued. So they went and got checked out, and she has these bilateral stress fractures. They kept her out for the rest of the whole winter season. She was on crutches and she's just now coming off, and potentially, most likely, she's staying out of her spring season as well. So when we ignore the pain, it can really do more harm than good because we don't know. A lot of times we say, "Well, just work through it," or "It's growing pains," or you gotta just stretch through it and push through. But we don't actually know, is there an actual fracture in there? So I'm gonna read something from that I found. It's from the Cincinnati Children's webpage. CincinnatiChildren's.org is the webpage, and they give you a definition about what is a stress fracture. So a stress fracture is a tiny crack in the bone that happens from overuse. So usually with repetitive strains and sprains, like repetitive injuries, repetitive work over time, like jumping and landing. Those repetitive motions over time will create kind of micro tears in the bone. It's a tiny crack in the bone. The difference between a stress fracture and a full-on fracture is a full-on fracture usually happens from like one impact. Stunt comes down, flyer lands on her arm, bone cracks in half. That's a fracture. And a stress fracture is more, it just kind of happens gradually over time. And so a lot of times we don't know that there's an injury because we just ignore that. Um, when, where is so some known risk factors that will lead to this is that repetitive overuse, high impact jumping, tumbling, stunting, and coming down hard, and then not having proper technique and form when you do it. There are some other medical health issues that are very indicative that they might have a risk, and I think this is the bigger issue. So my particular person that I saw this past week, she's had multiple stress fractures. She had some last year that kept her out of sports. She has since been found to have low bone density, and at 17 years old, that's a red flag. Like, what's going on? What does she need to look at? So they're looking at They have looked at her eating and looking at nutrition, because that plays a big factor in bone health, making sure that she's getting enough nutrition to meet what she's doing. And I think this is a big thing for cheerleaders, right? We tend to, especially our flyers, we want to keep them small, and so they are afraid to eat, or they eat limited amounts, and they're not eating enough to fuel what they're doing for the day. This can lead to poor bone health can lead to caloric deficit, and poor caloric deficit, which means you're not getting enough calories, would also lead to poor bone health. So it's a cycle. You typically then have low calcium absorption and vitamin D absorption, which actually helps to build bone. And of course, there can be genetic factors that will contribute into that as well. Some things that the Cincinnati clinic said, besides poor and improper nutrition, too much activity and increasing activity too quickly after a time off, not enough rest. That's a big risk factor for us as cheerleaders, because we don't take enough time off to actually let your body rest and recover. And then a combination of these risk factors, and females may be more likely to have not regular periods, and to be missing periods. And if your athlete has already started menstruating and they're a teenager, and there's no other cause like being on hormone, being on the pill, and they're starting to lose their period, then you need to really look at, is there a problem here? Are they getting enough food in? Are they pushing themselves too hard? Are they, what is their nutritional intake like? Are they getting enough rest? And, are they working out too much and too hard? Because those are all flags that there could be a bigger issue. This can be a real problem if the repetitive strain continues, because they're going to be, they risk developing further fractures and being out for longer periods of time. There's a higher risk of arthritis in the long run, which, if you know me, I don't consider that a huge problem, because I think most of us after the age of 25 get arthritis. But if it's limiting, and it's not allowing, if it's creating a limitation in movement, then that creates a problem. And if it's creating pain, then that creates a problem. So it is something to think about. You can have muscle and joint compensations and other problems. So in the case of a low back, low back stress fractures are very common for gymnasts and cheerleaders because of the hyperextension and that repetitiveness of, doing back walkovers and handsprings, coming down out of a stunt and cradling, and we tend to hyperextend. Or in the case of everybody wanting to get a needle, like that's a lot of repetitive strain through the lower back. And if you're starting really young when they have the flexibility and just kind of pushing and hammering through that, then that creates that repetitive strain and that what's called the pars on either side of the spine. And then that can lead to a bigger fracture, which can create some slipping of the vertebrae and contribute to leg pain, and on a worst case scenario, paralysis. Although I haven't seen anybody that's led to, but you can create that pressure, that sliding forward movement, and create numbness and tingling down the legs, weakness in the legs, and that's a big problem. Kids this shouldn't be happening to teenagers. It is very common, and it's probably more common in a teenager than an adult. But at what cost? So we really need to pay attention, like, are they doing too much? Don't ignore that repetitive pain, or that pain that comes out and they're like, oh, my back is really sore. Like, one time, did you do a lot more activity? That's okay. Multiple times, if it's going on for a couple of weeks, then that's something to get checked out. See your physician, check in with your physical therapist, do a movement screen, see if, take some time off, give it 2 weeks. If you're not feeling better, and now, do they have to sit still and lay in bed for 2 weeks? No, of course not. They can still go to practice. They can still walk through things. They just should stop doing the activities that create that pain, such as jumping and tumbling. And if they're base and holding overhead, trying to hold back on that. And I know we're in high competition season for All-Stars, and you guys are the biggest culprit. I think you're the biggest culprit because you don't really have a period off. The high schoolers, they go hardcore as well from August through now, the end of March. But All-Star, you guys are going, you have your tryouts coming at the beginning of May. You don't end your season until the end of May. It's just a big cycle, right? So we don't take that time off. But if we can listen to what our athletes are telling us, give them extended period of time off, especially if they're having pain, that pain calms down and then they gradually ramp their activity back up, then they will be healthier in the long run and they're not going to miss a long extended period of time like a semester off the mat. So what are some common signs and symptoms to look at? Pain that's worsening with activity and gets better with rest. So it should get better with rest. That's a good thing. But if it doesn't get better altogether and it just keeps coming back, then that's a flag. If there's any swelling, bruising, or tenderness in the affected area, so if they poke at it and they're like, oh, it's really sore, that potentially could be a sign. Something that's progressing from just kind of mild discomfort to sharp pain. My client that I saw this week, she was getting progressively worse through the semester and wasn't talking to her coach and was just kind of pushing through and wasn't sharing that information. And that was a big sign that, if she had taken maybe 2 weeks off in the middle of the season, she could have let that rest and heal. And then she might have been able to continue on through the winter. So she got progressively worse. They need to be able to tell coaches, and coaches, you need to talk to your parents to get your athletes checked out. So if pain is progressing from just a mild discomfort and it, once in a while to getting more sharp, then that's absolutely something to go get assessed. If they have a hard time bearing weight, they can't, stand and put weight evenly. So especially like in their feet, those are very common. Also with landing injuries, navicular fracture, which is the bone on the inside of the foot, kind of in through here. That's a very common area to get repetitive fractures. If we don't let them rest and heal, that could lead to a neovascular necrosis, which is decreased blood flow into the area and creates delayed healing, continues on with the pain, and eventually can create a need for surgery if we're not careful on that. So if they're having a hard time weight bearing and doing the normal activities, they should definitely go get checked out. And you might think, is there a stress fracture going on? Because this has been progressing over time. It gets better with rest, but it just keeps coming back. There's swelling, there's pain that progresses from low level to moderate to high level, and sharp pain and difficulty weight bearing. Those are all flags to definitely go get checked out. So some common treatments and prevention tips. From a medical standpoint, rest, taking time off the activities and modifying what they're doing. Sometimes they may need to be immobilized. So in an ankle and a navicular stress fracture, they might need to be in a boot for a while. And that absolutely means they can't be doing anything on the mat. This particular girl had to be on crutches for 12 weeks of doing partial weight bearing, which is like 50% of weight bearing. And when you have something on both sides, it's hard to actually go 50% on that. You can make lots of arguments for how much weight are you putting through. And then physical therapy, of course, for gradual return to activity. And for me, this means like I look at, do they have the mobility to do the activities that they need to do? That's the first thing they look at. Then do they have the strength and the stability? And can they take the strength training and doing gradual progressive strength training to then progress into doing loaded activities like jumping? To prevent and to promote healing, we want to make sure that they have proper nutrition and hydration. This means getting enough calories in. Make sure they are eating carbohydrates. So carbohydrates would be lots of fruits and vegetables. Those are a category of carbohydrates, but also things like whole grain pastas and beans and rice. Those are good, healthy carbohydrates that fuel your body and give you the glucose that you need, and also give you the energy that you need to help keep you strong. You need to make sure they're getting enough protein to help build muscle and to be able to create that pull in the bone, which helps the bone to heal. And then healthy fats to maintain healthy function throughout. And healthy fats, that doesn't mean we go and, just have cheeseburgers and fries all day. That's okay once in a while. We should absolutely be okay with that. But healthy fats, like, again, nuts, if you can eat nuts, those are a great way to get some healthy fats in. Avocados, even, a little bit of cheese is good. Eggs are good protein and healthy fats. If you want more information about this, please reach out and let me know. I have a few dietitian friends and nutritionist friends who really specialize in sports injuries, and I'm happy to share their contact information with you and get you some more information. Make sure we are monitoring their training loads and allowing time for recovery. So it is important to do strength training work. It is important to do conditioning work. But if we're going hard at practice all the time and we're in heavy competition season and we are then getting into the gym 4 days a week and really pushing our body hard, eventually that's going to break down and we need to take that time off and let it recover. So taking a good rest day every week. Maybe 1 day a week is doing some mobility and yoga and Pilates work that's not as stressful and not as impact. Limiting your high intensity interval trainings. They can be high intensity, but they don't need to be high impact. So getting the heart rate up and getting the training to build that conditioning up, but not necessarily adding more load and jumping into a program. The jumping and the load should happen off season, like really progressing the plyometrics and pushing that. You can do, some mid-season, but go heavier in that and building that power and that strength and that explosive power when we're not in season and doing repetitive jumps and tumbling all the time. Strength training programs that focus on bone health and stability, I think, are very important. And I talk about this all the time, how important strength training is. Having a good warm up to get your body ready to move, and doing things like squats, deadlifts, lunges, step ups, getting your upper body moving. It's very rare that I see. I don't even know that I've seen upper body stress fracture. Commonly it's low back and then hips and ankles and feet. So those all respond well. Once things have healed and calmed down, getting back into a gradual strength program that doesn't create pain can be very helpful to help build bone health. I'm really interested in this topic right these days because I myself am in menopause. And while that might be too much information, I'm looking back over the course of time and, what hormone changes have done, affected how I move and how I feel. And I think if we can start addressing this and, so all of the stuff that we talk about is related to your endocrine system, is related to your hormone system. It's related to, um, you know, how your body functions. And so start paying attention to that and teaching our young athletes, whether male or female, to be aware of what they're eating and making sure they're getting that proper nutrition, getting their rest, making sure they're hydrated, taking time off and allowing the body to heal and recover and just not do the impact for a period of time. And yes, that might mean a semester. Maybe it means a month, maybe it means 2 months, but not like when we were doing what I'll encourage, like all stars, when you guys start your tryouts, don't go right into pushing the skills. Like give them time to do some conditioning. Let's not build right away. Let's not do tumbling skills right away. Maybe you're doing drills to help handstands and strength, like handstand push-ups. You're not getting the same impact with that, and they're building core strength with that. That's fine. But stop the handsprings and the tucks and pushing flexibility to get needles or stretches, that are excessive. Let's let our kids heal and recover and build the strength and control and teach them the right way to move so that when we get to menopause, we are still in a healthy way. And point being there is, our hormones will fluctuate and that's going to play an effect, as they are fluctuating through the month for somebody that is still menstruating. It can take, they might have different areas where that impact is more intense for them. And so listening, just being aware of it. As we all know, having a period doesn't mean you have to sit out forever, or for 7 days, but maybe they go a little lighter, or maybe in those 2 weeks beforehand, they need to learn how to okay, I'm going to modify a little bit. I'm not going to do as much this week because I know my body is starting to fluctuate. And then keeping moving as we're able to. Movement actually is very helpful. There's too much information again, when I was in high school, I used to get sick all the time, every month, and my father used to have to come and pick me up. That's before they invented Advil. But what I realized as I got older, as I exercised more efficiently and I was consistent with it, and I was giving myself the time off to rest when I needed to, those symptoms all went away. And maybe it was growing up, but I do think that exercise actually helps to ease cramps and ease the pain of that. And put that together with bone health, if we can listen to what our body's telling us throughout the cycle and push when we are able to and back off when we need to, it can do a lot to avoid those overuse injuries like stress fractures and those repetitive strains. So that's my push to really pay attention to what your kids are telling you and listening to if they are having chronic aching pains, because stress fractures, they can occur and they are very common. And low back for cheerleaders and feet, ankles, navicular are also very common. And the fifth metatarsal, which is the pinky bone, kind of right here, the base of the pinky bone. And those are also very common stress fractures that we see, and with gymnasts and with people that are doing a lot of high impact jumping activities like cheerleading. Making sure, so look out for that repetitive strain, look out if they're, chronically having pain and it's getting progressively worse. And yeah, you can manage pain with going home and taking your Advil and taking your ice, putting ice on and just kind of letting it rest, or taking a Epsom salt bath. Those are going to ease those aches and pains, but it may not be enough. That's a good way to symptom manage, but it's not actually fixing the problem. The ibuprofen actually potentially could lead to a worsening of a fracture. So something to check with your medical provider about and make sure that, that's okay to do. They're not going to do a x-ray right away on somebody that is suspected of a stress fracture, because if they rest and then they gradually increase activity, that's a good sign, and they don't necessarily need that extra radiation. But if this is something that's been going on and it's getting progressively worse, it is important to ask for imaging. And no, you don't need to have imaging before you go to physical therapy. Your physical therapist could refer you back to the doctor to order imaging. So you might try that and see if you can kind of just get with low level activities, get the pain to come down. If it gets better, great, skip the imaging. Nobody needs that extra radiation in their body. But if it's getting progressively worse, or if the PT is finding symptoms that is, that just gets worse with any kind of exercise, then that's when imaging is definitely warranted. An MRI will show something that's structurally changed over time and maybe more indicative than an X-ray. A lot of times they will tell you that you can't have an MRI without an X-ray. I hope that that's something that changes in the long term, but time will tell on that. So quick recap. Stress fractures occur because of repetitive strains and a lot of high impact activities, a lot of hyperextension for the back. Other health issues that might contribute to a stress fracture might be endocrine changes, hormonal changes, as well as poor nutrition and hydration, lack of rest and lack of time off and healing. Signs to watch out for: progressive pain that's getting worse and worse, that changes from kind of a dull to a sharp pain, that gets better with rest but comes right back the next day. And common treatments would be coming into physical therapy, rest first, let things calm down, maybe immobilization depending on, the severity of the stress fracture, and then gradually ramping up activity. And no, when you get in, one thing that I heard this week was that, kids, they're like, I don't want to do 80-year-old exercises, which is like lying on your back and just kind of gradually building up. Kids don't want to do that activity, and I get that, but they have to do lower level activities that will train their body, that kind of test it a little bit. Things like straight leg raises and bridges, and maybe clamshells. I like to get away from those, and I tend to do a lot more stretch followed by stability, and get them up as soon as they have the control and they have good core control and they're not holding their breath, then progressing into the more advanced exercises like squats and deadlifts. But you gotta own the basics before you move to the sexy exercises. So that's my plug for you. Listen to your athletes, make sure you pay attention to what their symptoms and what they're telling you. And coaches, if you're seeing somebody compensate and they're limping or they're grabbing their back all the time, something's going on and they should get checked out. Even if it's a matter of you talking to them and just kind of triaging. And if you want some more advice on how to triage and look at that, just shoot me a message and let's talk. So I have a new membership called the Cheer Athlete Club that is designed to help cheerleaders stay injury-free and help to boost performance as well. As you know, we can't be completely injury-free, but to reduce our risk and to prevent as much as we can. This we go through exercises and there's time for questions and answers every week. So if this is something that you're interested in, I will post a link for that. You get a free 30-day membership trial so that you can check it out and see if it's for you. I want to make it special and make it really help you. So I'm looking for feedback on it. So as you join, we're going to build it as we go. So check it out. It's 30 days free, and then after that, it's $9.99 a month. Can't say that fast. So I want it to be affordable. I want it to be accessible and to be a space that you can, kind of go in one place and find the information, have a place to track it and keep accountable as well. It's a great way to boost your summer programs and keep your athletes accountable also. So check that out. That'll be in the show notes. I also am looking to, I have lots of free guides about mobility and strength and how to reduce injuries. So check those out as well. If you want to set up a free call with me to do an injury assessment or to do a mobility screen and see what's missing in your own and see if there's a way that I can help you get better and reduce injuries. If you just want to talk and say like, hey, I've been having this pain. Do you think that there's a stress fracture? Please don't hesitate to reach out. You can schedule a free call with me at any point. All of that is in the show notes. So thank you so much for joining me. You can find me on Instagram and on Facebook at the Cheer Athlete, the Cheer PT and the Cheer Athlete with the Cheer PT on Facebook. And you can email me, Laura@betterllc.com. So I look forward to hearing from you. If this was beneficial for you and helpful, please share it out. Please tell your friends and your fellow coaches and cheerleaders to subscribe, because the more we get this information out there, the better and healthier our athletes are going to be, and the longer they're going to want to cheer and be able to cheer as well. Thanks for joining me. I hope you have a great week. Don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything you put your mind to. And as my friend Drew Kelleher said, you're responsible for your own vibes. Let's go get the day.